right, so update. When you last saw me, my doorbell rang, and my neighbor took me to my appointment. Doctor sat me down in the chair, told me to look at the screen, if I could read some letters, and I read all of them, and he said, awesome. He's like, you're ahead of the game. He said, you're not supposed to read that yet. He said, that's legal driving vision. And he said, my eyes, he basically said the surgery went perfectly. And from then on, my eyes would get progressively blurrier. So this is 2 days later. He was right, my eyes got very blurry. Also talking to him, I told him, I said, hey man, I don't think the codeine, which was Tylenol number 3, I was like, I don't think it did anything. And he said, yeah, it probably didn't. And I wanted to smack him, because I was in a lot of pain. I took 3 of those things and still nothing. And I asked him, my wife recently got breast reduction surgery. I asked him if it was okay if I took a hydrocodone, which was 5 milligrams of hydrocodone versus 30 milligrams of codeine. And my neighbor, who's also a doctor, she said it's way stronger. My eye doctor said, yeah, I could take it. I got home, I took one, and oh man, I wish I had that right after the surgery, because as soon as I took it, I fell right asleep, no pain, got really good sleep. I actually missed one of my eye drop appointments, or not appointments, my scheduled eye drop times. So the doctor said it was fine. He says, I'd rather you sleep than get all your eye drops. Told me to keep my eyes closed as much as possible, which it's honestly, it's been hard to keep them open. Right now I'm sitting here on the couch with my eyes closed, kind of pointing this thing at my face. Things are very, very blurry. I'm wearing the same sunglasses. I've been sleeping in these. And thankfully I had them on, because I was laying on this couch and I had a blanket over my face, and my cat Rupert decided it was time to crawl up on me and snuggle, except he didn't know where my face was because the blanket was covering it. And here come his paws right across my face. So yeah, helped me from one injury so far. Yeah, and now he snuggled. The cats, it's funny because the cats they can almost tell that I'm in pain, because they've been a lot more, they're very snuggly anyway, but they've been very snuggly recently. They slept with me every night since the surgery. So I'm actually getting ready to go in. I've got a coworker who's gonna pick me up at 11:30 and take me to another appointment. I think he's going to remove my contacts and start me on some other eye drops. Maybe not. Yeah, we'll see where it goes from there. So far, I've been taking Tylenol. That's been helping with the pain. The pain kind of comes and goes. It's not nearly as bad. It gets up to like a 3 out of 10, and then it goes away. Right now, I'm not feeling anything. The Tylenol kind of helps with that. Another thing this doctor made me do that I haven't seen anywhere else is vitamin C. I've been taking, he tells me to take 500 milligrams morning and night. And he said vitamin C is what helps that layer of skin on your eye heal the quickest. So I've been taking that morning and night religiously. I've also been taking, just as a regular dietary supplement, is potassium, magnesium, vitamin D, and krill oil. He said all of those are okay. I've been taking those regularly. Yeah, so actually, and now that I think about it, now that I'm looking around, in the last 30 minutes or so, things have started to clear up. left eye's a little blurry, right eye's getting a little clearer. I don't think I would drive right now. Texting's very difficult. But yeah, hopefully in the next couple of days things will calm down. I'll be able to see a little better. I'll keep you guys updated. And of course I'm going to be posting all of these all at one time later when I can see. But yeah, I'll probably give you guys an update either after this appointment or in a couple of days, depending when I feel like it's necessary. But still overall, I feel like if I were to do it again, I wouldn't do PRK without getting hydrocodone first. Minimum. My neighbor, who's the doctor, she said the reason a lot of doctors are giving out codeine is because it's much harder to get addicted to it and abuse codeine than it is other ones. She says she tries not to, give out any pain meds or anything like that. But she said, in my case, she said she would have probably given me 5 Percocet. And the Percocet would have lasted me at least through that first 12 hours and into the next day. Even though Percocet's much, according to her, it's much easier to get addicted to or abuse that drug. But yeah, if I were to do this all over, if you're thinking about it, talk to your doctor and say, no, I want hydrocodone, 5 milligrams minimum. That'll at least help you get through some of that pain. Oh goodness, it was bad. I've been telling all my friends, they're like, well, how was it? And I'm like, get LASIK, don't get PRK. But no, it's really, I think just a stronger painkiller would have made it better, because I really don't think codeine did anything at all as far as pain. But right now I'm off of all the opiates, painkillers. I'm just doing Tylenol, which they said is okay. Just 500 milligrams seems like every 4 to 5 hours or so. And that's taken the edge off. Been drinking lots of water, staying hydrated. My eyes are still gushing tears. After I keep them closed for more than like 3 hours, I'll open them and then just enough tears pour out to come around and soak my chin. So it's my experience is different, much different than other people I've listened to or seen on the internet. I remember watching one lady said only one of her eyes did the whole tear up thing, and it was only once. So yeah, maybe I'm the worst case scenario. I suppose it could be worse. I could be blind, but I'm probably about as bad as it could get as far as healing wise. I feel that way as far as what I've seen. But yeah, I'll keep you guys updated, of course.